malaria sensitization for community health promoters. Location, Lailoba Community Social Hall. Date, which is today. And time, I will take around 4 hours of your time. And the schedule reads like this. From 8 a.m. to 8:30 a.m. registration and introductions. 8:30 a.m. to 9 a.m. overall overview of malaria prevalence in Lailoba community. Discussion of the impact of heavy rains. From 9 to 10 a.m. understanding malaria signs and symptoms. From 10 a.m. to 10:15 a.m. tea, coffee or break. 10:15 to 11:30 a.m. malaria diagnosis. That is rapid diagnosis test. From 11:30 to 12:30 we have malaria prevention and control measures. And from 12:30 to 1 p.m. question and answers, community outreach strategies. 1, we will end our section where we'll have closing remarks and distribution of training materials. On our task 2, I'm going to train you on 7 signs and symptoms of malaria. 1 is fever, which when it's high, it ranges from 38 to 100 or higher, maybe continuous or intermittent. We have chills and sweat, which is also one sign of the malaria. We have headache, which ranges from mild to severe, muscle aches and pains, noisy and vomiting, which leads to dehydration, fatigue also fatigue is one of the signs of malaria, and weakness. In severe cases, we have coma, jaundice, yellowing of the eyes and skin. We have also bloody stools. On our task 3, I'll be training you on how to use the rapid diagnosis test. Yes, I will show you how to use the rapid diagnosis test to see the extent of malaria. So you will first collect your materials. After collecting your materials, you will wear your gloves. Okay, collect your materials, clean your hands thoroughly with soap and water. And then, after cleaning your hands, wear gloves. And wear gloves. After wearing gloves, you will use the less active hand, that is left hand on my side. And in other case, you will have to ask your patient which is the less active hand. And now, these are my materials that I'm going to be using. I have the rapid diagnosis test. As you can see here, this is Africa. You will use this one you will use your middle finger . Yes, this is Africa, which you will use to obtain blood from your middle finger, and you'll have to be careful to avoid injuring your patient, and make sure you prick on You avoid pricking on the bone to avoid injuring the patient, and then after collecting your blood, you will place the blood drop on the sample on this one. You place your blood here. After placing your blood here, now we have here the results window. This will help you to read whether the patient has malaria or does not have malaria. On our control line, when it reads one line, that means that the patient is negative, does not have the malaria. And when it reads two lines, the patient is positive and is infected of malaria. Yes, this is our capillary tube which we use to pick the blood from the finger to place it on our rapid test diagnosis test. During reading your result, to know whether the patient is infected with malaria or not, you will use about duration of 15 to 20 minutes, and then you will read, record, and interpret your data. And after you have done recording and reading your data, your result, you'll have to dispose the materials, dispose them well. Yes, and on our task 4, yes, I'm going to train you about the control measures and prevention of malaria. Use insecticides, emphasize on treated nets. We have indoor rescue spray, environmental management, eliminate mosquito breeding site, like you can maybe drink stagnant water, clear bushes and vegetables around your home, dispose containers that can hold water. Another one, prevention, we have chemoprophylaxis, especially for vulnerable groups, which is children, pregnant women, yes, and the people with disability. Okay, we have prompt diagnosis and treatment. You can encourage seeking immediate medical attention if symptoms appear. As I finish my section with you, I want to do the summary of what I've done. Introduction and overview. Identify malaria symptoms and diagnosis. We have also done how to prevent and control measures, like doing some environmental management, and community engagement. Community engagement. Hope you have learned something and understand. Is there any question? If there's no question, I conclude that. My conclusion is the training is set to play a crucial role in the fight against malaria, helping to protect the health. Thank you for your time. And as I end my section, I will make sure that each one of you is able to do the rapid diagnosis test. I will issue these materials to you to make sure that you have tried and practiced how to measure, so that by your own you can carry out the practice without my supervision. I will supervise you now and make sure that you have understood how to carry out the rapid diagnosis test. Thank you for your time. See you later as I will be supervising you